Quarantines and even shutting down borders are some of the steps being taken by Nigerian and Liberian leaders to respond to a crisis caused by the worst Ebola outbreak in the three Western countries, Liberia, Sierra Leone and Guinea. An outbreak that has seen over 600 people killed and at least 1,200 people infected. And now African countries are being put on high alert to secure their borders from the disease that could be just a flight away. Just recently, Ebola was carried outside the region by a passenger on a flight that ended in Lagos, Nigeria, and who died just soon after he was isolated after collapsing. Just how safe are our Kenyan borders from the outbreak? Health Cabinet Secretary James Macharia, who Tuesday accompanied the First Lady Margaret Kenyatta to Taita Taveta for the Beyond Zero campaign, chose not to speak on camera on the matter, but said on the sidelines that the country has been on high alert since the first case was reported in March. Even though the Cabinet Secretary is on record earlier indicating that the country was not at risk, he now says necessary preventive measures, including testing centres at the airports, have been set up, with over 7,000 passengers from West Africa screened to date. The World Health Organization has raised its concerns about the potential spread of the virus, with 45 new cases having been reported in the region between the 18th and 20th of July. By today, probably more. The aftermath of the first such outbreak in West Africa.
The borders are very, very porous, so it's quite easy for people to cross from one country into another without detection, without using regular border crossings. So we see the most effective response to outbreaks such as this is to undertake clinical testing, laboratory testing, clinical management. Contact tracing is essential.
Ebola spreads through human-to-human transmission, with infection resulting from direct contact with blood, secretions, organs or other bodily fluids of infected people, and indirect contact with environments contaminated with such fluids. Evelyn Wambui, The Big Question.
We've been making contacts